It's frankly difficult to understand how a year since the first vaccines were administered, 3 in 4 health workers in Africa remain unvaccinated. While some countries are now rolling out blanket booster programs, only half of WHO's member states have been able to reach the target of vaccinating 40% of their populations by the end of the year because of distortions in global supply. Enough vaccines were administered globally this year that the 40% target could have been reached in every country by September if those vaccines had been distributed equitably through COVAX and AVAT. We are encouraged that supply is improving. Today, COVAX shipped its 800 million vaccine doses. Half of those doses have been shipped in the past 3 months. Our projections show that supply should be sufficient to vaccinate the entire global adult population and to give boosters to high-risk populations by the first quarter of 2022. However, only later in 2022 will supply be sufficient for extensive use of boosters in all adults. So I call once again on countries and manufacturers to prioritize COVAX and AVAT and to work together to support those who are furthest behind. Today, the WHO Strategic Advisory Group of Experts on Immunization, or SAGE, is issuing an interim statement on booster doses. SAGE concluded that the focus of immunization must remain on decreasing deaths and severe disease, and expressed concern that blanket booster programs will exacerbate vaccine inequity. About 20% of all vaccine doses administered every day are currently being given as boosters or additional doses. Blanket booster programs are likely to prolong the pandemic rather than ending it by diverting supply to countries that already have high levels of vaccination coverage, giving the virus more opportunity to spread and mutate. It's important to remember that the vast majority of hospitalizations and deaths are in unvaccinated people, not unboosted people. And we must be very clear that the vaccines we have remain effective against both the Delta and Omicron variants.
But I think this is a time of where the data is evolving. We're learning more and more. It's important that we do not conclude that vaccines are ineffective at this stage. We've said repeatedly, it's very unlikely that a vaccine will become completely ineffective clinically, because that's not how vaccines usually act. But obviously, we have to be driven by the data, and our recommendations will change accordingly based on the emerging evidence.
There's a lot more to do. I do believe we're still in the middle of this pandemic, unfortunately, but I completely believe that we have the power to end it in 2022. So vaccine equity and getting the vaccines to those who need them most in all countries must be a priority for every single government, not just some. We need to also be able to use tools to drive transmission down, because if we don't, we will continue to see the virus change and the virus threaten us in ways that will bring us closer to the beginning rather than closer to the end. What we are learning about Omicron is certainly we have this increased transmission, but the information on severity is still uncertain. We don't have that complete picture yet, and it is too early to conclude whether or not Omicron is less severe than Delta or is as severe as Delta. Now, we do have some data suggesting that rates of hospitalization are lower, some information that people who are hospitalized don't need as much oxygen or invasive ventilation. But again, we have not seen this variant circulate for long enough in populations around the world, certainly in vulnerable populations. We did learn some information this week that Omicron, as it enters older age groups, older people with Omicron tend to have more severe disease. That's unsurprising. We know people have died from Omicron. It's too early to conclude. We do know that people who are vaccinated have a much lower risk of developing severe disease and death to both Delta and Omicron. So we stress the importance of vaccination when it is your turn. Regardless of what information we do find out about Omicron and the different vaccines that are in use, it is better to be vaccinated than not. So if you hear anything from us today, please hear that and get vaccinated when it's your turn and fight like hell for vaccine equity for everybody else around the world.